Welcome. This is the pre-application webinar for PAR-25-439 Community Partnered Nursing Research Centers. My name is Karen Kale, and along with my colleagues, Dr. Maureen Akubo-Odero and Dr. Josh Wolf, we will be presenting to you today. Next, please. And next. Just a few tips for this webinar. First of all, participation in the webinar is not required to apply to PAR-25-439 Community Partnered Nursing Research Centers. This is a P20 clinical trial optional mechanism. All participants, except for NIH staff, have been muted. Participants must use the chat feature to submit questions, and you can submit questions at any time. Scientific inquiries and ideas for specific research projects will not be discussed today, but we encourage you to please email those scientific questions to Dr. Wolf, who is the scientific contact on the PAR. Due to time constraints, we may not read every point on each slide. However, all of the material that we will be covering is in the Notice of Funding Opportunity, which is in the chat box, and the webinar recording will be posted to the NINR website. If you have any technical difficulties during today's webinar, please send an email to Joanna Case at jcase@beta.com. Next, please. So today we're going to go through a little bit of NINR's mission and research lenses, which are the underlayment for this funding opportunity. Then we'll talk about the background, purpose, and some application specifics. We'll talk about some of the budgeting that's necessary and key points for the application, what happens after the application is submitted, and then a question and answer period. Next, please. So in talking about NINR and our mission and research lenses, we want you to understand where we are coming from as you put together your proposals. Next, please. The purpose or the mission of NINR is to lead nursing research to solve pressing health challenges and to inform practice and policy, optimizing health for all. Next, please. To do this, we encourage the use of research lenses, and our research lenses include optimizing health for all by addressing differences in the distribution of health and disease, identifying effective approaches to improve health and well-being by addressing the conditions of daily life, those conditions in which people are born, grow, learn, play, live, and age. Addressing the distribution of health by identifying and addressing pressing health challenges within and across populations and communities. Intervening at multiple levels to prevent and manage chronic and other diseases to promote health, and addressing the holistic needs of individuals, families, and communities through effective clinical and organizational solutions that leverage nursing research to optimize systems to enhance care delivery. Next, please. I'd now like to hand it off to my colleague, Dr. Maureen Akubo-Odero, who will give you some background information and talk about the purpose and specifics.
Thank you, Dr. Kell. Let's go through some information on the background, purpose, and application specific of this funding. This notice of funding is a P20 exploratory grant. The application type is new and clinical trial is optional. The award budget is limited to less than $500,000 per year in direct costs, and the project period may not exceed 5 years. Next, please. Thank you. We know that research is grounded in strong community partnership, and partnership is critical to advancing health and reducing health disparities. Interdisciplinary teams led by nurse scientists in partnership with the community are needed to develop solutions to address complex health challenges that consider the conditions where people live, learn, work, and play. Community partnerships have long been recognized by schools of nursing and colleges of nursing as central to both nursing education and service delivery. The relationship is forged in strong academic community partnerships that provide a foundation to advance impactful NAS-led research. Next slide, please. Thank you. The purpose of this initiative is to support the development of innovative research centers to foster nursing-led programs that promote community partner research to address persistent health challenges. Next slide, please. Center applications developed in response to this funding opportunity should propose strategies to strengthen the research infrastructure by 1, establishing or expanding centralized research resource in schools of nursing or colleges of nursing. 2, developing and enhancing NAS-led interdisciplinary teams. And 3, building expertise in community partner research through conducting pilot research that applies NINR research lenses. Next slide, please. In defining community partner research, community engaged research frameworks are typically presented as existing on a continuum that spans from traditional investigator-driven inquiries with outreach or education provided to the community partners to consolidate cooperation and those that rely on true partnership and collaboration. At the core of this community partner research, such as community-based participatory research and other partnership models, is a strong bidirectional relationship that meaningfully involves all partners throughout the research process, from identification of the research, question to study design, planning, and implementation through interpretation of results, dissemination, and translation. The relationship is built on trust and mutual respect. All partners are valued. All partners benefit from this research. They share decision-making, they share the power, and they share the resources through the strong partnership processes. Next slide, please. This funding opportunity requires involvement of not only the schools of nursing or colleges of nursing, but also one or more non-academic, non-research organizations that provide goods, services, support, resources, or advocacy to members of a defined community. Examples of these communities may be faith-based organizations, local businesses, neighborhood authorities and associations, and many more that are described in the funding opportunity page. Governmental organizations at the local, regional, tribal, state, or federal level also fall within this definition. Note that at least one partner should be a community organization representing the population of whose health and well-being is the focus of the research. Next slide, please. The main 3 objectives of this funding opportunity is to 1, to establish the centralized research resources in School of Nursing or College of Nursing. 2 is to build the center's community partner research expertise. And 3, to develop a NAS-led interdisciplinary research team that partner with the community in the development, implementation, and evaluation of research efforts. Next slide, please. For the application information, note that applications must follow the multi-project instruction in the guide. Here, we have a screenshot of what the page will look like once you begin your application. We emphasize that applications that do not comply with this instruction may be delayed or not accepted for review. Next slide, please. Here is a quick table of the key dates which are also highlighted in the funding opportunity. Next slide. Here we have a diagram of the center structure showing the components. All the center applications must include an overall section, and the 3 cores, which are highlighted in red, which is the administrative core, the pilot core, and the capacity building core. The pilot core should include plans for the 3 pilot projects, which are highlighted in orange, 1, 2, 3. And at least one of these 3 pilot projects must be detailed in the application. Next slide, please. Let's go through some key points on the budget. While I'm presenting an overview of this budget, if you have any specific questions on the budget, please direct them to Mr. Ron Watts, who's the grants management specialist and is identified in the notice of funding opportunity. As mentioned before, the overall award budgets are limited to less than 500,000 indirect costs per year, and this must reflect the actual needs of the proposed project. There are separate budget instructions for each of the components that we shall go through. Next slide, please. Let's begin with the overall budget. For the overall budget, the complete estimated funding section of the SF 424R4 cover. A budget summary in the overall section of the assembled application in the Image ERA Commons compiled from detailed budget data collected in other components filled out will be generated upon submission. Next slide. For the administrative core director, who is also known as the center director, must contribute no less than 1.8 person months out of the 12 months, which is also 15% of the time of the effort of the center activities. Make sure to include travel expenses of the center principal investigators, the core directors as necessary, key common partners, and the pilot PI's community co-investigators to attend each annual NINR center meeting. Also, include appropriate compensation for the community member who is listed as the co-investigator and for any community members serving on the internal executive committee. Next slide, please. The pilot core budget. For the pilot core budget, funds cannot be used to supplement research that has already been funded, regardless of the source. For personnel, include salary support for key personnel, including the pilot core director and other professional and administrative personnel. Salary support for the pilot PIs should not be included in the pilot core budget, as it is incorporated into the pilot project budget of no more than 50,000 direct costs. Pilot project budgets may be up to 50,000 per year for up to 2 years. Budgeted as a lump by the year. Sorry about that.
Can we move to the next, please? It looks like Dr. Okubo-Odero may be frozen, so I'm going to jump in until we see her moving again. So when it comes to the pilot core budget, as Dr. Okubo-Odero mentioned, you will budget a lump sum for the pilot projects, which can be up to $50,000 per project, and each project can be included in up to 2 years budget. Next, please. So the pilot core budget slide will look like this, and you see on the bottom of the right-hand screen here, it's marked, please to create a budget for each year of the proposal. So know that when you have completed this, that will be for year 1, and you will need to complete the same form for each subsequent year. Next, please. So for the pilot project budget, the budget for all pilot projects should be included in the pilot core budget. There does not need to be a budget section completed for the individual pilot projects. Dr. Okubo-Odero, are you back with us?
Sorry, technical difficulties.
Absolutely. Next, please, we're on the capacity building budget.
For the capacity building budget, the appropriate forms will be included in the budget. For personnel, include salary support for the key personnel, including the pilot co-director and other professional and administrative personnel. Other expenses, such as funds to support the capacity building activities, like workshops, are also included. For capacity building associated activities, such as printing and other advertisement materials, may be requested. As mentioned earlier, any questions on the budget, please address your question to Mr. Ron Wirtz, who is the grants management specialist identified in the notice of funding opportunities. Over to Dr. Joshua Wolf to present application key points to note for this funding opportunity.
Thank you so much, Dr. Okubo-Odero and Dr. Kale, and thank you all for joining us. I know this is potentially a busy week for some of you with Thanksgiving travel, and just excited that you're here. So a little bit about eligibility criteria. This can include higher education institutions, nonprofits other than higher ed, for-profit organizations, local governments. We're defining that as city, state, county, as examples, federal governments, which can include other federal agencies, and then other faith-based or community-based organizations. A little caveat here of non-domestic or foreign organization and non-domestic components of U.S. organizations are not eligible to apply. So that also means that for the pilot projects, that research cannot be conducted in foreign countries. You've seen this definition before in Dr. Okubo-Odero's slides, but just want to stress again that this involves, this NOFO requires involvement of not only a school or college of nursing, but also one or more non-academic, non-research organizations that provide goods, services, support, resources, or advocacy to members of a defined community. Next slide, please. Page limits are important to pay attention to. You have to include all of these components. Gotta be at least one page for each, but please do not exceed the page limits. The page limits are the maximums for each section or core. One caveat though, if you notice the asterisk next to the 6 in the pilot project column, just want to take you down to that explanation that says each pilot project detailed in the application may use 6 pages. At least one pilot must be detailed in the application. Next slide, please. Non-responsiveness criteria, these refers to applications that do not meet the following criteria will be deemed non-responsive and will not be reviewed. The first one there, applications that do not include a community partner as a co-investigator and key personnel in the overall application. Just as a reminder that community partnership is really at the heart of this NOFO, and so we really want to emphasize that piece here. Next bullet there is applications that do not include at least one pilot project described in the application. And the last bullet is applications that do not include a community investigator as co-investigator of the pilots described in the application. Another area where you see just the emphasis here. Next slide, please. So for the overall portion of your application, here's a few things to remember. You also want to attach information about grant support and center collaboration. So this could include, for example, the network of the community partnerships that an application is proposing. A research plan, which is going to include the specific aims and research strategy. A few bullets to highlight there. This must include a rationale highlighting the unique contribution or gap area. In other words, how is the proposal that is submitted going to address that gap or dearth of scientific knowledge? A structure and plan for the center, and coordination and interaction between core components. These are just some of the important parts of this section. And reminder to please refer to the NOFO for additional information that is necessary to include in the proposed research plan. Next slide, please. For the administrative core, the first portion there, the research and related senior or key person profiles. So you must have a center director who is also the contact principal or primary investigator or program director who must also be the administrative core director or project lead. There must be a community member or representative from a community organization must serve as a co-investigator, and one key or senior person must have business management expertise. In terms of budget, but also relevant here for this person's level of involvement, the center director must contribute a minimum of 15% time and effort to this project. And you must include appropriate compensation for the community members listed as a co-investigator and for any community members serving on the internal executive committee. I'll talk a little bit about that committee in a couple of slides coming up. Also, we've gotten multiple questions about whether there can be multiple PIs, and the answer to that is yes, but you must still have a nurse with a research doctoral degree and who is contributing that minimum 15% effort, even if you're using multiple PI structure for your administrative core. Next slide, please. Your research strategy must describe and justify the administrative core structure and interactions with each other core, the role in coordination and functioning of the center, the utilization of funds and shared resources, ongoing evaluation of the center's progress or an evaluation plan, a sustainability plan, and oversight of the structural components. I'll talk about those acronyms on the next slide. You also must include letters of support, and please refer to the note for some additional specific instructions on letters of support and the types that need to be included for each of the components and cores mentioned in the application. Next slide, please. These are the acronyms that you've seen a couple of times on the previous slides. The first IEC is Internal Executive Committee. The IEC will assist the center PI in the allocation of center resources, the identification and selection of key personnel, and the planning and execution of center activities. The Community Advisory Board, or CAB, this is probably an acronym that many of you have seen before. Its primary responsibility is to assure that the center reflects the principles of community-partnered research. In this approach, the CAB should be integrated into the planning, implementation, evaluation, and dissemination of all center activities. And lastly here, this might be a SOAC. This may be a new acronym for some joining us today. This is the Scientific and Operational Advisory Committee, which its primary responsibility is to provide guidance on the selection of pilots and scientific advancement of the center, and for efficient operation of the center and plans for sustainability. You may be wondering who should be on each of these committees or board. Please refer to the NOFO for specific instructions of what membership should look like for each of these boards and committees. Next slide, please. And so the pilot core, this is the kind of the oversight of those 3 pilot studies that have been mentioned earlier. And so the senior or key personnel, the pilot core director must hold a research doctorate and have an appointment at the applicant school or college of nursing. The research strategy must have a plan for scientific merit review of pilot proposals. This is within your application. It is internal in the sense that we're not saying that that's done by NIH or the Scientific Center for Scientific Review, which many of you may be familiar with if you've submitted applications to NIH before. And so again, it's going to have to be sort of a rigorous explanation of what you're proposing for scientific merit review. It also must convey funding decisions for pilot proposals. It guides the development and implementation of the pilot proposals, and it maintains important records for them. As we've noted a few times, that the requirement is that only one of the pilots needs to be detailed for the pilot projects. Therefore, for the others, you may use what's called a delayed onset study mechanism, where these are sort of it's a way for applicants to talk about what the plan is, but not necessarily have as much detail as what you would see in that one pilot proposal, that it is going to be much more fleshed out in the application. Next slide, please. And a little bit more about the pilot projects themselves. So each PI must be a nurse and have an appointment with the school or college of nursing. And they can be either an NIH defined early stage or new investigator without current or past individual NIH research support. Individual means funding at the R or U level typically. Generally speaking, that's not getting a fellowship or a career development, a K award, does not count as individual NIH support. And they may not, or someone who is an investigator who has received individuals NIH support as a PI for no more than one project. So a maximum of 1 R or EU would be applicable there as examples. And as I mentioned before, this must include a community co-investigator for the pilot projects. Next slide, please. The research strategy must, for this, the pilot study should be a discrete, well-defined project that can realistically be completed in 2 years or less, and that requires limited levels of funding. It may not be exclusively secondary data analysis. The key word there being exclusive. You can still use secondary data as long as there's also a primary data component to it as well. At least one of the pilot projects must start during the first year of the award. Clinical trials are optional here, but they must, if using a clinical trial, it must adhere to all NIH and NIR clinical trial policies. And the application must identify whether human subjects would be involved, which of course requires additional protections and inclusions per NIH rules. Next slide, please. And just this may be familiar to many of you, but just want to emphasize because it is important in terms of whether or not it could be reviewed. The NIH definition of a clinical trial is a research study in which one or more human subjects are prospectively assigned to one or more interventions, which may include placebo or other control, to evaluate the effects of those interventions on health-related biomedical effects. And that figure to the right there is just some examples. These examples are on the NIH website. And as mentioned earlier, these slides, this presentation will be available. Next slide, please. And this is the decision tool. This is also on the NIH website. Encourage each of you to carefully go through all 4 of these questions. This is actually the same checklist that NIH staff use to make sure that an application is correctly submitted as a clinical trial or not a clinical trial. If the answer is yes to all 4 of those questions, the study is considered a clinical trial. Next slide, please. And some of you may be wondering what happens if something says it's a clinical trial and isn't, or vice versa. So the first scenario, if the application states it is a clinical trial, but it is not upon NIH staff review, administrative adjustments may be required prior to the award. So that essentially creates more work for the applicants as well as for staff. The second scenario there, if an application states it is not a clinical trial, but it actually is a clinical trial, the application must be withdrawn. So again, we put these slides in here, even if you're familiar with the definition of a clinical trial, it's really important to carefully go through these criteria and that checklist on the previous slide to avoid having a misclassification. Next slide, please. The capacity building core, some key points here. The funds from your budget are used to support activities such as workshops, research fora, symposia, center retreats, and seminar series. So you're kind of building excitement, enthusiasm, looking at ways to keep this scientific energy going from the center. The specific aims that it must address is how does the capacity building core impact the development of academic investigators at all stages and roles, community investigators and community partners, and provides resources for the successful conduct of meaningful community partnered research. The research strategy section must describe plans for conferences, meetings, webinars, educational programs, and materials, and there must be at least one event annually generated by the center. Next slide, please. And so this is what happens after the application is submitted. Next slide, please. I'm going to go through this section a little bit faster because it's probably familiar to most, if not all of you joining us today. That said, if there's something you'd like me to talk more about here, please feel free to put a question in, or if we can't get to that question, feel free to shoot me an email. I'm happy to talk more about any of these pieces as well. So what happens after an application is received? It then goes to the Center for Scientific Review, Division of Receipt and Referral. From there, we use the acronym DRR commonly for that. From there, DRR assigns it to a scientific review group as well as a scientific review officer. They also assign it to an institute as well as a program officer, although that will likely be me for these applications. And so I want to stress here that all of the applications coming in through this NOFO will be assigned to NINR, and they're all going to be reviewed in this same study section if you submit for that upcoming January deadline. Also, after you've submitted your application, the scientific review officer, or SRO, is typically your best contact for the most up-to-date information on the status of your application. That's from the time you submit it to the moment you get your summary statement. Next slide, please. And so the review criteria, these are described in detail in the NOFO. So this is just very high level overview. There's 5 scored review criteria, which is the significance of the research, the investigators, which includes aspects of their qualifications and experience, the innovation of the research, the approach, which includes the strategy and the methods, and then the environment, such as the institutional resources to support the investigators. Each of these gets a score on that 1 to 9 scale that probably most of you have seen before. Additional review criteria, that means that these don't get separate scores, but that these can still be used by reviewers to make final scoring decisions for their overall impact score. So this is study timeline. This is only for clinical trials, protections for human subjects and the adequacy of that, inclusion of human subjects policies. This includes race, sex, ethnicity, and age across the lifespan, vertebrate animals if applicable, and biohazards if applicable. All of these reviewers are encouraged to use to arrive at their overall impact score. Next slide, please. And with that, I will turn it back to Dr. Dale.
Thank you so much. And thank you all for the many questions you've already put in the chat feature. Please continue to put questions there. We'll answer as many questions as we can today. And we're really going to focus on questions that are relevant to all applicants. If we don't get to your question, or if you have a question that's specific to your community organization or the science you're proposing, please reach out to Dr. Wolf or Dr. Okubo-Odero by email. You can send your questions, you can send AIMS, and they're happy to address them. You can also email scientific inquiries and specific AIMS pages to the NINR program at nih.gov box. This box is looked at by Dr. Wolf and myself, and we will absolutely get back to you. We do highly encourage you to make an appointment with one of the program officers that you see here today to discuss any questions you have that aren't addressed, and just to go over the overall application if you are planning on submitting. We know this is a complex mechanism. Next, please. Just a couple of final reminders before we jump into questions and answers. So the first submission deadline is January 25th of 2026. Please note this is not an RFA, it is a PAR. So there are multiple receipt dates. We have additional receipt dates in January of 2027 and January of 2028. Please take a look at the core components. You need to include an overall section and admin core, pilot core, and capacity building core all need to be included in the application. You need to plan for 3 pilots, but only one of those must be detailed in the application. And all of the details, all of the information on all of these slides comes directly from the Notice of Funding Opportunity, which is available on the web. One last reminder for folks, please do check the Notice of Funding Opportunity a day or 2 before submitting your applications. Things change fairly rapidly at NIH, and we want to make sure that if anything changes, you have that information up front. Next, please. So let's go into a few of your questions, and all 3 of us will jump in to answer as many of these as we can. I'm going to start with one that was brought up about the deadline. At this point, the due date is indeed the 25th of January. We do not have any control over changing due dates or allowing late submissions. Please do take a look at the NOFO for submission dates. But we do note that this has been a challenge, knowing that we have not been available to you until recently. Josh, can you address what's included in the page limit for each component?
Sure. So this is really going to emphasize sort of where you are writing more of your own narrative. So that would include the specific aims, the research strategy. Again, you really have to go in depth here. It's not sort of just some of the other templates where you're just checking yes or no on a pre-filled form from NIH.
Thank you. One question that's been asked is NIH has been moving to a model of awarding multi-year funded awards, or all of the money would be awarded up front. And that's been seen with RO1s and some other mechanisms. The question is, should we plan for a 5-year budget at once, or will the budget released year after year? At this point in time, NIH does not have any direction from HHS on whether or not we will be doing more multi-year funded awards for FY26. Please remember, we are still on a continuing resolution, so we do not have a federal budget or appropriations that would give us that type of specific guidance. Another one for you, Dr. Wolf. Please define what is meant by a research doctorate.
Sure. So a research doctorate, let me just pull up, grab a slide here on this to make sure I give you exact answer. Sorry, I lost my placeholder here. So a research doctorate is a PhD or an equivalent, so like a doctorate of science, or it would tip for this application. A DNP is not counted as a research doctorate. That doesn't mean that DNPs can't be involved in your application, though, and we encourage you to look at eligibility and the NOFO itself for where other types of faculty, scientists, and professionals can be involved in the center.
Thank you very much. So we've had a number of different questions about whether or not core directors, the center director, and others could serve in dual roles and what's permissible. And I think I'll jump into this one because it's a little bit more complex. So there is nothing in the funding opportunity that says you cannot have people in dual roles. However, there are some things that, if you think about from a practical aspect, make sense to have separate. For example, the administrative core director and the associate director really kind of have to be separate people, because the purpose of having that associate director is that if the center director or administrative core director would need to step down for any reason, you want to have someone who is fully versed in everything that's happening with the center that's able to step up. So in some cases, it might not make sense. The other thing to think about is that you need to explain why you are using people in dual roles and how that will be handled if there are places where that might lead to questions about conflict of interest. Those types of specific questions for your specific center make the most sense to talk to Josh or to Maureen individually so they can look at the larger picture of what's happening in your particular center. Josh, there have been a few questions about not being able to get into Assist and being able to get the application in. Can you please address those?
Sure. So the earliest that anyone can fully access Assist and start uploading their application materials is December 26th. So that's when some of you have sent me screenshots and said the apply button isn't working. On December 26th, that apply button should be activated, and that's when you can go in and start uploading your materials.
Thank you. So we have a couple of questions about pilot studies and kind of more generally, whether or not the pilot studies all need to be with the same community partner or whether you can have multiple community partners involved in the center and the pilots.
Sure, I can take that one. You are allowed to have multiple community partners. So it could be the same or it could be different partners for each pilot. One of the important things of this, and I encourage you to look at Section 5 of the NOFO, which is review criteria, is regardless of which direction that you decide to pursue, make sure you provide strong scientific justification and an explanation of why those partners, how you'll work together, and really make a compelling argument to the peer reviewers.
Thank you. We've had a few questions about how many awards will be made for this. And please remember, this is a PAR, not an RFA. So there are not any set aside funds for this like there are for an RFA. NINR is really excited about this opportunity, but the number of awards that are made will be based on the number of applications with meritorious scores and NINR's budget. Okay. We have an abundance of questions. It's just which one do we want to jump to next here? I think we'll address this one because it's come up a few times. So, and Josh, I know you've worked on this a lot. Can you confirm what roles require that the person in that role be a nurse scientist, and what, if any, cores could be led by someone who is not a nurse scientist?
Sure. So I'm just going to read sort of word for word out of the NOFO here and redirect you back to that. That's a great question, though. But according to the NOFO, the P20 director, this is the center director, must be a nurse, hold a research doctorate degree, and be a faculty member at the applicant school or college of nursing. And this second part is if you're using multiple PIs here, only the contact PI must be a nurse and hold a research doctorate degree. The pilot core director must hold a research doctorate degree and have an appointment at the applicant school or college of nursing. Notice, though, that one does not say must be a nurse. And then for the pilot project PIs, these are one of these three breakouts from the pilot core. They must be a nurse, have an appointment with the school or college of nursing, and be an NIH-defined early stage or new investigator without current or past individual NIH support, or be an individual who has received individual NIH support as a PI for no more than one project. If you're still unsure of what funding is considered individual, feel free to shoot me an email.
Great, thanks, Josh. We have a lot of questions regarding budget, and some of them are very technical and probably very specific to one application or another. But there are a couple of things that I want to bring forward. So one of the questions that I'm seeing quite a bit is, if our community partners are not being paid off the grant, do they need to be included with biosketches, or should they be in letters of support, and where should that fit? I will point out that it is very clear that the budget for the administrative corps, as well as the other corps, must be appropriately allocated to the School and College of Nursing and to the community partners. So if community partners are on, one community partner will be on your executive committee, and they will be involved with multiple different aspects of the award. That's someone that you should think about what's appropriate budgeting for. When it comes to who does there need to be a biosketch for, according to NIH policy, all senior key personnel and other significant contributors need to have a biosketch in the application. So if you've got a question for your particular project of whether or not someone fits into that, please do make an appointment with Dr. Akubo-Odero or Dr. Wolf so that they can go through that with you. It does get confusing sometimes when we're working with community partners in terms of who's an other significant contributor versus who's a consultant. So we do encourage you to ask those very specific questions. We had I'm just trying to see which one of the next one I want to hit here. Josh, if you've got a hospital system or a healthcare system, can they be a primary community partner?
So I want to, that's a great question. We've seen that question a few times, and really just want to direct everyone back to that definition that of what is community organization, a community partnership, and that it is it's an organization that is non-academic, non-research, that provides goods, services, support resources, or advocacy to members of a defined community. So really kind of zero in on that non-academic, non-research part. And again, especially if, if there's formal affiliations with that hospital and a medical school or a school of nursing, I would say send me an email then if you're not sure, and send me a link to that hospital, other relevant information, and I'll get back to you.
Thanks, Josh. We've gotten several questions about whether or not those key personnel also need ERA Commons accounts. And according to NIH policy, all personnel who are listed as senior or key personnel do need to have an ERA Commons account, and they have to have their Commons account listed on that biosketch. So again, please do set up an appointment and we can talk with you about who really are key personnel, senior and key personnel versus other significant contributors or consultants. There was a question about travel for core directors and other directors, and what does it mean that it's as necessary? And I can take this one too. So the plan is to have in-person meetings for all of the centers at NIH, most likely, but possibly elsewhere, on an annual basis. So it is up to each center to decide who is best suited to attend that. We absolutely want to see your center director. We want to see your pilot PIs, especially the ones who may be presenting on their work. We would like to see some of your community partners involved as well. It may or may not be appropriate, depending on your center, to include the pilot core director as part of that meeting, or include the capacity building core director. What those meetings will look like is something that will be shaped more by the community of funded investigators as we move forward with this. This is a new P20 program, and we're really excited to work with you to help find the best ways that we can use that in-person time to help everybody's science. Okay, let me pull one or two more here. The collaborations publication table, which is part of the application, doesn't have a time frame. Should that be the past 5 years, or what kind of time frame would you recommend, Dr. Wolf?
I'm sorry, I missed the last part of the question, Dr. Carroll.
Certainly. So the collaboration publication table, just like the list of collaborators that we ask for as well, doesn't have a particular time frame. How far back should people include publication? Should it be over the last 5 years? Should it be over a different type of time frame?
Yeah, that's an interesting question, and I think I would answer that. I can't give you a absolute one way or the other. What I would say is try to put yourself in the position of a peer reviewer looking at your application. And if you have evidence that there have been successful collaborations, successful partnerships, that could be very relevant to making a case for qualifications and feasibility, even if it hasn't been done for a while. And I want to say on the flip side, even, if there's been something very recent in terms of collaborations, but it's not at all relevant to your proposal, then that might not be as strong to include. So I think, again, sort of think about how you make a strong argument to a peer reviewer that we can work together and we can successfully accomplish this.
Thanks. So we've had a couple of questions about pilot PIs and who can be pilot PIs. And the question is, if we partner with other schools and colleges in the university, are people from those other schools and colleges able to be pilot PIs, and can they get pilot funds? Now, I'll start by reminding folks that the PAR does say that investigators who are eligible to be academic pilot investigators must be a nurse and must have an appointment with the school or college of nursing. So, Josh, is there a way that folks from other schools or colleges could also be involved?
I think if those criteria are satisfied, that they would also have an appointment with the school or college of nursing. Certainly, we might see, I imagine, dual appointments to more than one school. But again, for eligibility criteria, we're looking carefully. There must be a nursing appointment there.
Along that line, if we wanted to have MPIs for a pilot, would both of the MPIs have to have an appointment at the School and College of Nursing, or would both of them need to be nurses?
Both of them would need to meet that eligibility criteria.
Thank you so much. We are getting near the end of our time. If there are any last minute questions, please pop them in. We have not gotten to everything, and we're well aware of that. But as we said before, we do encourage you to reach out to us individually, and we're happy to address any of those things we don't get to. So one last minute question we have here, would published abstracts in a peer-reviewed journal be considered a publication for purposes of the application?
Dr. Kell, do you mind taking that one?
I'm happy to. So if it's particularly pertinent to what you're doing, it might be something that you want to reference and include. It is certainly something you could include in the biosketch if that's pertinent to what the work is being done for this center. So yes, it can be included. Do be aware, sometimes reviewers do take a look to see what those references really are and what the articles consist of. We have been delighted to answer your questions. I'm going to end us on one more here. Give me just a quick second. Just as a final, we've said this before, but as a final question, Josh, can you remind everyone what is considered a community organization?
Sure. And again, it's a central part, and we've gotten a lot of questions. So it is a non-academic, non-research organizations that provide goods, services, support, resources, or advocacy to members of a defined community. And there's actually, for sake of time, I won't read them, but we've given you numerous examples of that listed inside of the NOFO. And of course, if you're still not sure, feel free to reach out to me.
Thank you all very much for your time and attention today. We know that you probably have more questions, and we are very much looking forward to meeting with you and talking about them. Final reminder, in a couple of weeks, this webinar will be posted on the NINR website. So if you have questions that you know we answered, but you don't remember what we said, please do take a look for it. And we wish you all the best as you put together your applications. Thank you very much.
Thank you, everyone.